Hair transplant is classed as surgery, and in the UK we must make sure that the doctors who are performing it are registered with the General Medical Council, and that is the GMC, and also trained in that particular procedure. The patients can also make sure that the doctor is at least a member of the ISHRS, which is the International Society of Hair Restoration Surgery. Hair transplant is a form of surgery, which is a medical procedure or a surgical procedure. In the United Kingdom, it is an absolute necessity that these centres or clinics are registered with the Care Quality Commission, which is CQC. You must also make sure that the doctors or the personnel, which is the hair technicians, etc., who are working there, are also vetted by the Care Quality Commission. Hair transplant surgery is gaining popularity in the UK and the rest of the world. In the United Kingdom, it is expected that the invasive parts of the procedure should be performed by the doctor and nobody else. For example, the incision making, the administration of anesthesia, extraction of the follicles. In some clinics, these responsibilities are being delegated to hair technicians. Now, the hair technicians are very experienced and they're very good at what they do, but still they are not supposed to do any part of the invasive procedures. As a patient, you also must ensure that you are seeing the doctor who is going to perform the procedure long before the procedure is booked in. Also, as a patient, all your questions need to be answered appropriately before you go ahead, and there should be no undue pressure put on you to book in to have the treatment. Hairs naturally grow in clusters. Some of the grafts are single hair grafts, or 2, 3 or 4 hairs can be there per graft. Some of the clinics, what they do is they divide the grafts to make more numbers. In our clinic, we try to make sure that the grafts are kept as intact as possible to give you the number of grafts. So when a clinic is quoting you the numbers, be careful whether you ask them whether it is a graft that is being transplanted or the number of hairs. It is slightly misleading for clinics or doctors to say that the transplanted hairs are going to be permanent, because we know that the hairs that are on the back of the head, which is the occipital area, or the side, which is the parietal area, they stay on the scalp for a long time. In male pattern baldness, the hairs that are in the front and on the middle, which is the vertex, they are susceptible to dihydrotestosterone, and hence they go gradually over a period of time. However, we also know that the hairs that are on the back of the head will also gradually go in the later stages, and hence some of the hairs that we have transplanted are likely to go in the future.